At the Global Liver Institute, we believe it all starts with a patient. So what happens when a patient, a liver patient no less, one of the 500 million people living with conditions that often go undiagnosed, untreated, or misdiagnosed, mistreated, and stigmatized, brings the challenges of liver patients front and center? And what happens when a patient then leads a discussion with world experts in policy, research, clinical care, and wellness on ways to overcome these challenges? Let's find out today on GLI Live. Hello and welcome to this episode of GLI Live as part of our October's for Livers special series focusing on issues in liver cancer. I'm Donna Cryer, the founder and CEO of the Global Liver Institute and your host for today. And I am really profoundly appreciative that our guest, Jada Desmarais, who comes to us from the healthcare advisory practice at the esteemed Baker Newman Noyes in Portsmouth, New Hampshire, is going to give us some real talk about the real cost of cancer care and explain to us why terms of financial toxicity are not just jargon, but have an impact on the lives of patients and families. So welcome, Jada.
Thanks for having me.
So what is financial toxicity? It sounds like another side effect of cancer care.
Well, Donna, it really is. So the term financial toxicity is something that those of us who've worked in cancer care have used to describe the financial impact that treatment has on a patient. So there's a lot of different factors that can impact financial toxicity. And that can start with reduced income because the patient has to stop working to do their treatment. It can also be factors such as being uninsured or underinsured or having an insurance plan with really high deductible. So all those can factor into what we would call financial toxicity. And that just is the impact that the out-of-pocket costs of getting cancer care can have on a patient. And some of the signs of financial toxicity are things that impact their treatment journey. So they can start missing treatments, doctor's visits. They don't fill prescriptions because they can't afford to, or they skip doses because they want to try to prolong the time between refills. And then you see the far extreme of financial toxicity where patients can't pay their bills. Patients can't afford groceries. And the worst case, patients end up in bankruptcy due to the cost of their care.
I remember receiving bills from my liver transplant, but before I even got back from the hospital, and my parents would bring me these bags of my mail, and we realized that there were bills in there that but I hadn't been home in weeks, and so how could I possibly have answered them or even attempted to pay them, because I was still in the process of receiving care, still hospitalized. And so it is something that is machine that's going on, behind the scenes. And so you've had a long career across healthcare advisory and finance. And so tell us how you got involved in these issues and developed your expertise to be able to help patients and families.
Sure. So I spent nearly half my career actually working in cancer centers, and then I did switch to consulting. However, I think the pivotal moment for me and why I became so passionate about financial toxicity and the need to mitigate it was due to a conversation that I had with a patient's husband. And it was one of those conversations that you just never forget. It really rocks you to your core. And we had failed this family. She was uninsured, and they were months into her treatment and had about $120,000 of outstanding bills at that point. Being the leader of the department, I was faced with having to have a conversation with the husband who called to complain about their bills and that, frankly, they couldn't pay them. And it was what he said to me in that conversation that really shifted the way I thought about the financial side of cancer care. He said, "You care more about money than my wife's life. I'm going to lose my wife and I'm going to be homeless." And I thought, that's, nobody should have to feel that way ever, and I felt so terrible because as an administrator, it was my job to make sure we got paid for the care that we received. But deep down, we all cared more about every patient's life than money. And that's really where my passion for battling financial toxicity began.
Oh my, but sometimes there are moments that you look back and realize that were meant to happen, so that you could have all of these experiences and skills and this expertise to benefit all of us. And so I think that you're meant to have that conversation. And I thank you for listening to what it said to your heart and spirit about where you needed to go next. So why is cancer treatment so expensive? When I was talking with my staff, we were putting together all this information. We know that the cost of healthcare overall in the United States in particular, and GLI is global, so we look at how different national health systems are constructed. But in the United States, we spend $71 billion on cancer medication alone. There are so many other parts of cancer care, but just on the medication alone. And so why does cancer treatment have such a fundamental impact, even for those people who have insurance?
Well, I think there's a couple factors to that. I think number one, like you said, the cost is increasing. I do a lot of reading about what's going on in the industry. And I recently saw a statistic that was pretty concerning, and it's already high, but the cost of cancer care is projected by the American Cancer Society to increase 34% from 2015 to 2030. So that's a 34% increase in 15 years. And I think some of that is driven by the technology that's coming out when it comes to cancer care. And technology may not be the correct word, the new treatment modalities. Right. So these advances in treatment options, such as immunotherapies, and immunotherapies are really the new wave of treatment in cancer care when it comes to drugs, right? But they're extremely expensive. So they're expensive to develop, and then they're expensive to actually administer. We had a patient who his out-of-pocket cost for his immunotherapy, because it was deemed off-label, so that meant the insurance wouldn't cover it, it was going to be $10,000 per treatment. So these are very, very expensive treatments. However, the flip side of that is patients are living longer. Right. And patients are living with cancer versus dying. So while the expense of these drugs is one piece of it, I think the other piece is patients are living longer with cancer, but that requires ongoing treatment. So when I think about it in terms of, the most expensive diagnoses out there, you've got heart disease, cancer, you have neurological disorders. And I think about my father. He had a heart attack, 10 days in the hospital, quadruple bypass. His bill, which he didn't pay entirely for, insurance covered, it was probably in the six-figure range. But he hasn't had any bills since because he's doing well, which is great. But a cancer patient who has metastatic disease needs to continue the treatment to prolong their life. And that perpetuates the ongoing cost. So I think that's some of it as well. It's a good story. There's more cancer survivors. But with all those people surviving cancer, many of those people are on ongoing treatment. I remember we had patients that came every 3 weeks for years.
I think that you're absolutely right. We are so grateful for all of the innovation that we've had. Someone asked me the other day, why there weren't more, liver cancer advocates. And I said simply, most of them died. Liver cancer still has, for most populations, a less than 20% 5-year survival rate. And so people didn't survive long enough to become liver cancer advocates. And so we are so grateful for all of the innovation that we're seeing in the liver cancer space, and more companies coming to do research specifically for liver cancer and liver metastases and even rare liver cancers. And so we want that to continue. But we also need to partner on solutions to make sure that people have access to it and that it's affordable. So you're absolutely right. There does need to be that balance. Would having more emphasis on prevention help make things more affordable? The WHO says that 30 to 50%, some estimates even say up to 70%, particularly of liver cancers, are preventable. Is cancer prevention covered? Does that help lower individual costs or, population costs, or help with this issue of financial toxicity?
Yes. I mean, I do think that there's two aspects to it. I think more needs to be done in the healthcare industry to prevent disease. More emphasis on disease prevention. I think our healthcare system is challenged in that providers get paid when they see people with problems. And it would be really interesting to see providers get paid to prevent people from having illness instead. So I think that's one part of it. And while I do think cancer prevention is important, I would also argue that routine cancer screenings are also important because there's so many factors that can lead to a cancer diagnosis. And some of that is just genetics and family history. If you have every woman in your family has had breast cancer, there's a really good chance that you may also have breast cancer. So catching cancer early is another, I think, very, very important way that we can reduce the cost of cancer care, because the earlier that it's caught, the less treatment that could be needed. Skin cancer or some of the other cancers, you go in, there's surgery, they remove the cancer and you're cured, versus a stage 4 diagnosis with a very low probability of survival and lots of heavy duty expensive treatment to even prolong life.
Absolutely. In liver cancer, hepatitis B vaccination, hepatitis C cures, which are now far less expensive than when they first became available. Resolution of NASH, even though there's not a FDA approved drug therapy yet, if caught early enough, we can help people with 7 to 10% weight loss, or bariatric surgery, or some of the diabetes medications that are very cost effective, well before people get to cirrhosis or needing transplant or needing liver cancer, particularly at a stage where it can't be, surgically resectable. And so I do think that part of this conversation about lowering the overall cost of cancer care and the impact that has on both at all the levels, at a national level, at an insurance plan level, and on an individual level, has to be about shifting some of the focus to getting these cancer preventative services to people in a meaningful way.
Right, exactly. And just as they've recently changed the guidelines for colon cancer, now starts at 45, I think there also needs to be a hard look at preventing cancers earlier, because there's a lot of research out there showing that, especially in some of the GI cancers, they're hitting people younger and younger.
Absolutely. And every patient with a diagnosed liver disease should be going in for 6-month screenings for liver cancer. And yet we know that isn't happening. And so, when we think about some of the, more difficult, they're not insurmountable, but the more difficult issues of reaching out to people in communities who don't have a connection to healthcare, and really don't know their risks at all. but people who already have a diagnosis and are in the system, it seems such a waste to not get them in for 6-month screening. It seems to be something that we should, easily be able to accomplish before we move on to harder things.
Right. And I think that providers have to have better systems for helping their patients remember
Mm-hmm.
what their needs are, because sometimes your health issues are so overwhelming that you can't remember things like,
Right.
oh, I need to go back in 6 months, and
Mm-hmm.
so as a healthcare system, I think we owe it to our patients
Mm-hmm.
to have systems in place so that they're not lost to follow up.
Mm-hmm. So what do you tell families who are, received a diagnosis of cancer? Is there asset planning, estate planning? Are there financial tools? What can help people navigate cancer more successfully, with a good health as well as a good financial outcome for themselves?
Well, I think as cancer care providers, one of the most effective strategies they can implement is having a financial navigation program. So, what I mean by that is a financial navigator can help educate patients on how to make their way through the healthcare system. And this starts right at the beginning, helping them understand safety net programs like Medicare or Medicaid, or helping them understand the current coverage they have under a commercial insurance provider. Insurance alone is so incredibly complicated, and I think many of us don't fully understand how our own coverage works. So add that with a cancer diagnosis, and it can be extremely overwhelming. And then beyond insurance, the other thing that financial navigators can do is they can help patients get external assistance. So there's so many programs out there to assist patients financially, but it's complicated. And the foundations open and close. The funds are available, then they're not available. And a very well-trained financial navigator can help patients understand the nuances of those programs, help them apply for aid, and also can help them through the drug companies. The many drug companies have copay assistance, free drug, and other free drug for treatment, not free drug. But there's so much out there that I think the cancer patient would never be aware of because they just it's too complicated, and they're so overwhelmed with their diagnosis that the financial navigator can say, I've got you there. I'm taking this burden off you. We will figure this out. And they really become part of the multidisciplinary care team. So you always think about a care team. You think physicians, you think, nurse practitioners, nurses. Those are the people you think about. But I would advocate that having a financial navigator is just as important to address the financial toxicity of the care.
I think that that's brilliant. And certainly we know that there are some programs, some hospital systems that do have both sort of an administrative or financial navigator as well as the clinical navigator. And I think we take that as a note as an advocacy organization that should be more of the norm. So that can be the expectation for, a patient or family facing liver cancer, GI cancers, that they will have sort of both types of navigation services available to them. So many of our patients, it's really amazing to me that as their disease becomes more advanced, I hear over and over again from their spouse or caregiver, and then I had to quit my job to watch over them. And I wonder what happens to the family, to the children, to everything else, to the roof over your head, if you now have to quit your job to look after the patient. And so even if the patient recovers, can the family ever recover from that illness? And so I think we need to do more, both at the system level and at the advocacy level, to support families to be able to come out whole on the other side of something like this.
Yeah, and I've seen it with my own family. Having lost my brother-in-law at a young age to cancer, the impact it had on my sister-in-law and my nieces and my nephew. They're still not fully recovered from the financial losses due to the expense of his care. And I do think that cancer care providers need to work harder and try harder to address this aspect of their care, and that they owe it to their patients, because it's great if you can cure someone of cancer, but if they lose their house in the process, I don't know that the outcome
Right.
it's of course you want the life and you want to live, but you need a quality of life as well. So it's so important.
Absolutely. One thing that, the very earliest decisions, understanding which doctors and hospitals are in network and what's out of network, can be a make or break decision. Are there other sort of just, key intersections along the way, or sort of key choices that have, that type of huge, financial impact, of course, depending on your plan?
Right. I mean, I think it starts with the coverage, making sure you're using an in-network facility, an in-network provider, and co-providers. If you have to have surgery, the hospital could be in-network. However, the surgeon could be out of network, and a lot of surgeons are independent and bill independently. So I think what's important is these conversations are difficult to have.
Right.
Nobody wants to be talking about money when it comes to their treatment, but they're so important to have up front, because if a patient is educated on what the cost of their care is going to be, they're going to be better prepared to face what's coming, right? And I think that patients themselves need to also be more proactive in this. It's okay to say to your doctor, I need to better understand what this treatment means to me financially before we proceed. That's okay. And again, I think these are conversations that in the healthcare industry, we've traditionally not been comfortable having.
Right.
As the cost of healthcare increases, and as more cost gets shifted to patients, even those who are insured, I think we're seeing more and more cost sharing shifting from employers and insurance companies to the patients. We really need to be having these conversations, and patients need to be more educated on the fact that it's okay to ask these questions up front.
I was at a dinner the other night, and we were talking about one of the advocates started her career as a school teacher, and she said she wished that that there was more health education in schools, but also more financial education, that sort of financial literacy, health insurance literacy is so important for everyone to know, to have some basic grounding in, to be able to move forward, because you never know when you might need it. It's not as if you can predict, well, at this stage I'll need to understand how to use my insurance plan. It's something that everybody at some point will need to be able to navigate. And so are there resources just before you need them, that places people can go, or programs that are highly respected that teach sort of health insurance literacy, that you could think about? Or how can people prepare themselves before they are really in those dire circumstances?
I'm not as familiar with what's available out there for patients, and I absolutely agree. I think that high school seniors should be required to learn how to balance a checkbook, which I know is a term of the past. Most of it's online now, but you know what I mean. And also get education about the things that adults have to make decisions on, like what health insurance means and what does it mean to not have health insurance. So I couldn't agree more with that. I mean, I think that from a cancer perspective, there is, through the Association of Community Cancer Centers, there's something called the Financial Advocacy Network. And they have a huge abundance of resources available to cancer centers as far as how to help your patients from a financial advocacy perspective. What I think we're lacking in the broader, scope is that type of education for patients and families. There's also the Patient Advocacy Network who does have a lot of information available, and that's another good resource that I think is developing, and I see they're putting more and more information out there. However, you have to know where to look for it. You know what I mean? It's not, I don't think that, a person on any given day would even know about these organizations. So I think that there needs to be more conversation in general about this. You hear on the news about hospitals with, facing financial losses and staffing shortages, and you hear about all that. But what you don't hear as much about is how the healthcare system is impacting the people receiving the care.
Right. So hopefully this conversation can help raise the issue with people. We often talk about going into the Thanksgiving season and talking about organ donation and other things with your family. But I think just the basics of how do we navigate healthcare and how do we make healthcare decisions and can be part of keeping the family whole. And should be part of the family discussions as well. And so we'll definitely put those resources that you mentioned in show notes and things available with this episode. We do work with the Patient Advocate Foundation. We are working with increasingly with AHIP, the American Health Insurance Plan, on some insurance literacy information. But how do we get it to people in the normal flow of their lives so that they have it before they need it, I think is our key challenge. But we're so grateful. Yeah, go ahead.
When they need it, they're already overwhelmed with a diagnosis, right? So it's information overload at that point.
Right. So Jada, thank you so much for the work that you do on behalf of patients and families, and thank you for using your own personal and family experience and story to make the world better. I really appreciate our time today.
Yes, thank you for having me.
Please be sure to like this video, subscribe, and share your thoughts and suggestions in the comments below. Join us weekly on Wednesdays at noon Eastern Time for more episodes of GLI Live. Check out our website, globalliver.org, and follow us on social media to learn more about the Global Liver Institute and stay up to date with the latest in liver health. Until next time, stay safe, stay well, and stay connected.